So Domain 4 is community organization, and essentially that is trying to understand your community and your community's readiness to change. And that's by gathering data on your communication, on your community, trying to assess the level of programs that are already in existence, access the level of need, but then it's about building up buy-in from your community. And I feel like the key to a lot of prevention that we do is about relationships. So you are trying to develop relationships with everybody from your sectors. So that might be with law enforcement. So you might work with your local police chief and try to help him understand what the coalition is about. Trying to get youth on board, parents, and it's all about building up a relationship so that they understand the problem and want to get involved in making a difference with that problem, helping them to see what their role would be.
It's very, very important in the work that we do. For one important reason is the science really shows that coalitions are one of the most effective models for prevention when it comes to the outcomes and the changes that we want. Of course, SAMHSA's Drug-Free Communities grant is built around the coalition model, engaging 12 sectors of the community in that work. So it's a part of that DFC program, which folks viewing this video that may be the role. You may be a Drug-Free Communities coordinator, so this is going to be very important for you to understand the coalition model, not just the structure of it, but the science behind it.
Community organization is a huge part of the prevention field. I would say it is one of the most important skill sets because it's going to help feed any other part of the work that you're doing. I think understanding who is in your community, where your allies lie, what kind of skills are out there, what domains people can represent, having a clear understanding around a history of a particular community. Whether this was a mill town, did they have a shooting here? Did they have fires? Is this a migrant community? Those kinds of things. Having a clear understanding of what those communities look like, and also being able to build relationships with the different components of that, whether it be within your faith community, business, parents, teachers, education, administrators, all of those folks.
Probably for me, one of the key aspects of community organizing is engaging stakeholders. And so first of all is identifying who stakeholders are. So a lot of folks think of stakeholders as people in prominent positions, and they are stakeholders like the police chief and the mayor and the superintendent of schools. But those informal leaders, or what our millennials call influencers, right? They don't necessarily have to have an office, but they're go-to people. And so when I was working in a community in Providence called Silver Lake, I asked folks, who's the go-to person? I said, well, what do you mean? I said, the person that if you want to have something happen in this area of Providence, who do you go to? And, Rhode Island's very Italian, so guess who the name was? His name was Vinny. So I said, where can I find Vinny? And they said, well, he kind of holds court in this particular coffee shop every morning. So I went to the coffee shop and I found out who Vinny was, and I went over and I sat down and I said, my name is Sandra, and I told him when I wasn't, could I talk to you for a minute? He said, why me? And I told him why. I said, because everybody told me that if you want anything done in Silver Lake, you have to go to Vinny.
I think that there's an assumption that we invite people to come because we're doing good work, feel good work, and we have a good cause, and we have data support, and everybody should come and want to do this, as if nobody else has any other work to do, right? And having an understanding of what other people are doing in the community and how what you're doing can dovetail in what they're doing, and can they integrate what you're doing into what they're doing instead of starting something new, or showing up to the table and say, here, this is how prevention can really push your arts project forward, right? Did you know that the arts can really be a protective factor for young people in our community? Have you considered doing a project that engages older adults and young people so that we can reduce the isolation of older adults and create protective factors and skills for young people? Would that be something you would consider doing? And so there are opportunities for partnerships in that kind of way.
Doing more investment in the coalition model is probably one of the most effective things that we can do. I mean, the science really does show that it's really one of the most effective things we can do.
One of the things is about community readiness, and I think I made the mistake very naively when I was first working in this field. We had a series of tragedies in the community that I worked in. There was a lot of underage drinking. There was some fatal car crashes, so it was very painful for the community. And I wanted our coalition to be changing the laws, be making a lot of policy changes very quickly. I felt like, it was very urgent, and but the community wasn't ready for that. So what we had to do is kind of, this is all in hindsight, I learned this, but what I really needed to do is probably listen more to where people were at with this issue, and really educate slowly about this issue, about the impact of it, rather than want to charge in there and make change and make a policy change that might not have been enforced if that policy if the community wasn't ready for that. So I think that's something, maybe some advice is maybe really trying to understand where your community is at in terms of readiness for policy change, and then work on getting community champions. So that might be other people from other community representatives to help pass that policy. So it's not just coming from the coalition. Well, our police chief and this victim's parent and the high school principal, they all feel that this is important.
So when we were implementing this Families in Action program in Lewiston, Auburn, so an important piece of that was our community coalition, which was built around this Safe Schools, Healthy Students grant that was held by the Lewiston and Auburn school departments. So we had that coalition, and we had as part of that coalition representatives from the New Manor population and community in Lewiston, Auburn. And so we already had them kind of engaged in the grant, and then we invited them into the sort of the initial planning meeting with the program developers of the Families in Action program. And originally the intent was just to kind of get their feedback and thoughts on how we would implement the program in a way that was going to be accessible to the New Manor families. That really dovetails into other parts of the other domains, but the strategic prevention framework. What we ended up doing is building more capacity in the New Manor community around prevention. So, it was a specific program, but it provided opportunities to weave in other kind of prevention education and training for these 4 folks that we hired as facilitators, and they became great leaders in the community around other prevention and public health issues. So it was a chance to strengthen our coalition, to strengthen our delivery of the program in a culturally competent way, but it was also increasing capacity in the community.